This summer, the Departments of Agriculture and Health and Human Services released new dietary guidelines, but this year, the recommendation for flossing was nowhere to be found. In an Associated Press investigation, it was uncovered that the previous flossing recommendation was never actually backed up with empirical evidence of its benefits. So, should we floss? Joining me to discuss this is Dr. Donna Williams of Morningside Dental. Welcome, Dr. Williams. I know what your answer is going to be already.
Thank you so much for having me. And yes, we should floss.
But there aren't many studies out there that point to flossing as actually keeping your mouth healthy. So should people care? Should we just all chuck our floss out the window?
So I'm sure that there are probably many people who would like to throw their floss out the window. And I do say that, in the dental community, we need to make sure that we are better instructing people on how to floss and different flossing alternatives. However, we absolutely need to floss, and I can guarantee you that 100% of the dentists, well, not 100, but a large number of dentists and hygienists all see the benefits of flossing, and we can definitely see when a patient is flossing a reduction in the amount of bleeding gums that they have.
So over time, as you're seeing your patients, you see if they've been flossing,
yes,
improvements.
Yes.
Okay, so one of the things that was found out in sort of parsing through whether or not we should be flossing is that, obviously brushing with fluoride toothpaste has helped to cut down on cavities and severe periodontal disease, but it hasn't been proving that flossing does that as well.
Flossing is going to do two things. It's going to remove the plaque and bacteria that lie in the area we call the sulcus. It's the area just underneath the gum, between the tooth and the gum. And so the flossing will go in and remove that bacteria. In addition, it also helps to stimulate the gums and help to make them stronger.
But it also prevents other diseases, right?
So cavities and gum disease have both been reduced with flossing, with proper flossing.
Okay, so why don't we have more studies of this,
So I think primarily what has been said is that the research needs to take period over a longer period of time, and that's why there are not a lot of flossing studies. But sometimes they're just things that we empirically know, and they're things that we empirically see. And patients themselves can tell a difference when they floss versus when they don't.
I know I personally can, but I sometimes think that it's because of what's going on in my mouth, maybe the flora, how well I floss, whether I'm actually hugging the tooth or not. Mm-hmm. I don't want to name any names, but someone in my household just whips through the teeth without actually hugging the teeth, and so that makes a huge difference, right?
It absolutely does. It absolutely does. I will have to confess, though, that I have spent over the years quite a bit of time having to instruct people on the proper way to floss, and you do need to have pretty good dexterity, and some people don't have that, which is why there are other flossing alternatives. But there is nothing that will do a better job than flossing properly and making sure that you're forming that C shape just before you put it down underneath the gum line.
Now, does the type of floss you use matter? Because I know there are some flosses out there that make it a little easier, more comfortable to use, mm-hmm. that glide up and down the teeth, but maybe aren't doing the job as well.
So there's a bunch of different types of floss. There's also super floss. There's different types of floss that you need to use to get underneath orthodontic brackets, to get in between your crowns and bridges. The wax floss is usually better for teeth that have tighter contacts, but any type of floss is good.
Okay. The wax floss, though, is really a lot harder to use, which I try and avoid it, but.
So certain people find the wax floss easier to use.
Okay. Yeah. Well, to each his own. Now, but
so you do have to really kind of find your way as to which one is better for you. And working with your hygienist is an excellent person to help to make that happen.
And there are some people, though, who may not need to floss as much as others. Right? You're like, absolutely no.
Yeah, the ones that don't have teeth, basically.
Well, if your teeth are spaced further apart.
Yes. Yeah. So definitely, if you have more spacing, it's easier to get the toothbrush in between the teeth. However, making sure that you're getting underneath the gums is quite important. So you have to make sure that you're doing that, and the flossing is the best way. I really wanted to take a moment to point out the importance of when you have chronic gum inflammation, that is a precursor to diabetes, stroke, and heart disease, and many other illnesses. So we're not flossing just to keep our teeth. It's really a lot larger than that.
All right. Well, on that note, we'll end it there, and people will have to just take the bad news that the experts say flossing is still necessary.
Absolutely.